Welcome back to Houston Life. For your health, we're focusing now on how to treat epilepsy and seizures. If you or your loved one has ever experienced it, it can be scary and even life-altering.
But with medical advancement and innovative technologies, there are ways to manage epilepsy. And joining us now is Dr. Hina Dave with Memorial Hermann to tell us more about their program. Now, doctor, epilepsy is the second most common neurological disorder after stroke. It affects nearly 3 million people. What causes this?
Yes. So I'll first start with the basic definition of what a seizure is. And a seizure is basically excessive excitation of a group of neurons that can cause many different symptoms, either staring off into space, deja vu, or full body shaking episodes, or even just jerks of the body. When someone has repetitive seizures over and over again, that's a chronic condition called epilepsy. And at that point, that requires treatment. In terms of the causes, there can be a wide variety of causes, including traumatic brain injury, stroke, in some of the child population, the pediatric population, metabolic disorders, genetic disorders. But at 40% of patients, I do not have an etiology for why they have seizures or epilepsy.
And that can be really scary, just not knowing why it's happening.
Yes.
Yes, and so it can affect a wide variety of ages as well, as you were mentioning.
Exactly. I predominantly treat adult patients, but yes, it can range anywhere from pediatrics to the adult population and can present at any age.
Now, doctor, is this something that you start off with as a child and then continues throughout your adult life, or can you start in your adult life with epilepsy?
Yes, I see a lot of patients that start with epilepsy in their adulthood, in their 20s and 30s, for sure, yes. And these patients can present with different types of seizure types. There can be one type is a focal seizure, where basically the seizure starts in one focus, in one hemisphere. And the other type is a generalized seizure, where basically both hemispheres of the brain are activated at the same time. And then some patients may have, seizures that start from different areas of the brain. And as I said earlier, they present with different features and different symptoms.
And if you think that somebody is having a seizure, or you think you yourself are having a seizure, what is the first thing you should do?
Yeah, so in terms of seizure treatment, basically you want to, support their head. You don't want to hold down their arms, don't put anything in their mouth, and you want to turn them onto their side. So those are the seizure safety symptoms. And if their seizure lasts for more than 5 minutes, at that point you call 911. And in terms of evaluation for seizures, there's a whole bunch of tests that we do, like imaging, EEG. And in terms of treatment, we typically start with medications first. So patients that have focal seizures, we start with medications, but if they fail 2 medicines, then we consider surgery in those patients, or even devices. For patients with generalized seizures, where the seizure starts all over the brain at the same time, medications and devices are the treatment for them.
And you want to make sure to get the word out that some people just live with these seizures because they don't think that there are treatment options to help them, right?
You're exactly right. And in our epilepsy center, we're all neurologists. We do extra training in epilepsy, and we are specialists in finding new innovative ways to treat patients with medications, clinical trials, surgery, or even devices. And I'm located at the Woodlands location, the Memorial Hermann, with Memorial Hermann Hospital. And we have something called an epilepsy monitoring unit, where I bring patients into the unit, and it's a hospital bed, basically that's wired to have video and EEG capabilities. EEG is a brainwave test. So we're able to look at video, EEG, also their heart as well, to see if they may have a different type of event. Maybe it's syncope. And during that time, the patient is monitored for 24/7. And we actually are able to pinpoint, and we collect all this data and analyze all the data to see what type of seizures they have, and even if they actually have seizures at all. And this information is gathered, as well as imaging, neuropsychological testing, other tests as well, to figure out if maybe they might be a surgical candidate that may make them seizure-free.
And that truly is incredible that we have this resource right here in the Houston area, because it is not a common thing. You have a very unique unit designed to treat seizures and epilepsy. So it's really fortunate that we have that here in the Houston area.
Yes, no, definitely. It's quite rare. We're the only community hospital in the Houston area that is located outside the TMC, or Texas Medical Center. So it's really easy for patients to get to actually be seen by me, and also evaluated by an epilepsy physician in the hospital when they're in the EMU.
Yeah, the EMU sounds like a legitimate, specialized way that can really pinpoint things that you might not see at a normal physician's office, right?
You're exactly right. And we're recording 24 hours a day. And I'm actually able to bring, take the patients off the medicines during that time to actually see the seizure, which is really important, because that data, we need that data.
And their baseline.
Exactly.
In a safe environment.
And they usually stay anywhere from 3 to 5 days when they're in the hospital. And during that time, we really want to understand what's going on a day-to-day basis. Because if I just do a short EEG in the office scenario, it's only 20 minutes. And it's only capturing 20 minutes of their brain waves.
Right.
Yeah.
It's truly incredible. So I know you've obviously been doing this for a long time. What have you seen kind of develop here in the last few years in terms of research and technology for treating epilepsy and seizures?
That's a great question. I would say that our center is one of the most prominent epilepsy centers in this area, really in the southern Texas area. And we have a really wonderful program in terms of surgical opportunities, so patients can go through surgery, be seizure-free. We're doing something called a minimally invasive procedure called SEEG, where we're actually able to record from the brain tissue itself without putting a lot of harm to the patient, and actually figure out if we're able to do anything more for that patient. So it's less of a risk. We also have new devices that we can implant that can treat the seizures continuously and change the way the electrical signals pass in the brain to reduce seizures. And I'm also running a clinical trial program, so we have new and upcoming research coming out, or new medications or new devices that we can potentially have patients participate in, where they can see if that's the right option for them, because they may have tried so many treatments over the years, and there may be something new that might help them out significantly, at least reduce the risk of a lot of mortality or morbidity.
Absolutely. I know a lot of people watching are just taking notes on if they could possibly be seizure-free. I know that they would absolutely love to do that.
Yes.
Dr. Hina Dave, thank you so much for all the wonderful information. And if you'd like more info about epilepsy and treatments at Memorial Hermann, visit their website at memorialhermann.org/epilepsy or call 713-222-2273.